Hi, welcome back to Antai Hospital's YouTube channel. And in today's topic, we'd like to continue on the discussion of HPV infection and treatment with the focus on a specific question we've gotten recently, which is if the patient is currently still in the incubation period, which means the period where she may or may not be infected with HPV infection, what should she do in this period? Now, this can apply for both uh, men and women. So, those of you who have engaged in unprotected sexual intercourse and we are still unable to confirm whether or not you were infected because it takes some time to actually develop this infection. So, even if you go for tests very soon, you're still unable to detect this. But the presence could be there. It's just that it needs some time to incubate and actually show up in these tests. So what we recommend is that for patients who have suspicions that they may be infected, you may or may not be infected, or you have engaged in unprotected sexual intercourse and you are worried, then the course of action is to go for screening checkup every 3 months. So you don't need to go every week or every month, every 3 months. And if you are still tested negative, then rest assured, it's very likely that you are not affected, you're not infected at all. However, if you are tested positive after that 3 month screening, if you go for the second try again on the second, third month, and if you are still positive, then you will need to go into treatment as soon as possible. Another option is that if you are still in this situation, why not consider going for preventive treatment? And we do offer this preventive treatment, and it can help you a great deal in preventing future infections and cancers as well. So that's why preventive measures are still the priority for our patients. So preventive measure that we do here at the hospital is simply whether or not you are infected or not. If you are unsure, if you are still in the incubation period, just simply come for one course of treatment, which is just application of our medication, Antai, just once. And after that, immediately go for HPV vaccinations. And you can enjoy the benefits of very likely no more development of this infection. Because when you are in the state of limbo, where you are unsure, preventive measure is the right course of action, and we do prevent potential complications of HPV infection. You don't want to wait until these lesions, these complications, the warts, the diseases such as Bartholin cysts, vaginitis, infections of the vaginal canal, condyloma, all of these things. You don't want to seek treatment until these things show up. Although yes, you can choose to receive treatment when these complications, symptoms show up, but then at that time, course of treatment will be much more difficult for us on our end. Treatment period, the time taken will be longer as well, and also you'll be putting much more financial burden on yourself, so it's going to be much more costly. But if you choose to take the route of preventive treatment, only once application of the medication, and you can save a lot of money, you can prevent all these complications that I've mentioned. So it's definitely a win-win situation for our patients. So if you do find yourself in this peculiar situation, now you know what to do. Don't wait till these signs, symptoms show up. If you're unsure, quickly go for preventive measure. You can definitely prevent some disastrous complications, especially when we're talking about cervical cancer, precarcinoma, CIN1, CIN2, CIN3. At that stage, if you go for conventional treatment, they'll be suggesting you much more destructive, invasive procedures where you may potentially lose parts of your cervix or the entire uterus as well, which is considered excessive treatment in our point of view. So why not consider Antai, where you can see immediate recovery within a 6-month period. If you do not recover, then we offer you money back guarantee. And at the same time, you can retain your uterus, which is a very important organ if you are still keen on having more children and also avoiding side effects of organ removal. We've mentioned that time and time again. So in this video, I hope you've learned what you need to do, which is preventive measure, and receive a preventive dose of Antai just once, so that you can be assured, no more anxiety, and you can prevent all these complications that I've mentioned. And also keep in mind not to go for these invasive, excessive treatments where they remove the cervix. They recommend hysterectomy. These are very invasive. Always get a second opinion. So I hope you've learned all that information, and please stay tuned for more videos on this topic. Leave me your feedback down below and stay tuned to the next one.